Dr. Kahng, tell me about sleep apnea, because lately I have heard lots of news that sleep apnea, number one, most people who snore, not everybody, but most people who snore have some type of sleep apnea, which means they stop breathing throughout the night for a few seconds, all the way up to a minute or so. And sometimes only a couple, 2-3 times a night, sometimes 10-20 times an hour. So there's degrees of sleep apnea, obviously. And people who have sleep apnea, which is most people who snore who have it, and they don't know it. They might know that they snore because their spouse tells them, but they might not know that they have sleep apnea. They are next morning tired and exhausted, fatigued. In fact, the news out there these days from the medical field is that apparently there are more people dying from car accidents because of sleep apnea than from drunk driving. That's pretty bad. In fact, in New Jersey, just a few weeks or months ago, a bus driver wrapped a bus around a ball and killed many people, and they suspect sleep apnea. So that's a big problem. Even if you don't fall asleep driving, which nobody wants, but just being exhausted and fatigued during the day, we're talking work, productive, being happy, not being grouchy because not sleeping is just not a good thing. Shed some light on it. Tell us, from what I said here, how much of that has hand and feet and is true. And here's the thing. Dentists apparently are some of the best people, not the only one, but some of the best people to fix it. True or not?
Yeah, the sleep apnea, the dentists, they can fix the sleep apnea because the many case, the patient, the sleep apnea, the patient, they don't know about they have sleep apnea because they are sleeping, so they don't feel anything. So while they are snoring, sometimes they block the airway, and also they cannot breathe, and it causes some good sleep. So they can feel some fatigue, or during the daytime they are so sleepy, and sometimes it can cause a very dangerous situation. And if you go to dentist, and the dentist can make a simple appliance, and then while sleeping you can wear the appliance, it can prevent your sleep apnea. So it's very easy solution to fix the problem. So go to the dentist, and then you can have a consultation, it can be fixed.
All right. Is it true that people who have sleep apnea and stop sleeping to a lesser or a higher degree throughout the night, that they're then tired, exhausted, and fatigued through the day, and because of it they're more grouchy, they maybe get more headaches, they start yelling at their friends' kids, and they're just simply not all up to par when they work, because work demands to be at its best constantly. Otherwise we don't make it these days. Is that true that is a side effect of sleep apnea?
Oh yeah, that's right. Because simply they didn't have a good sleep. They cannot breathe. Also they feel so fatigued and they cannot concentrate their work. So it can cause lots of their social activity to the patient. Also that's very dangerous. Mm-hmm. While they are driving, they can fall in sleep. It can cause a real serious accident while they are driving. So there has to be fixed.
Right. So I heard that, there are sleep labs out there which test people whether they have sleep apnea or not. They're frankly very, very expensive, $1,000 and more, or anyway, somewhere in that neighborhood, depends on where, when, how. Now, while it is fine to have a machine telling you wake up 6 times, 10 times, 20 times, whatever it is, and you don't sleep or don't breathe for a minute or whatever it might be, while that is a valuable data to have, does a person really need that? Because if I snore, and if I just a little bit feel exhausted and tired, more than I think I should be, which is almost everybody anyway, but, go ahead, get that appliance, because it's really not very expensive, and you will feel better, most likely, less tired, less exhausted. You don't need to have first tested it, because it's the result which counts anyway, not what some measurement says. And B, you will at least stop snoring, which, I mean, that gotta be good if you're married. I mean, that gotta be a good thing. Yes or no?
Yes, that's true. And just go and fix. And another thing is, most time the insurance company, they pay for the device for stereo apnea. So there is no reason to wait for that. And you can have a good sleep, and your spouse can be happy about stop the snoring too.
Yeah, absolutely. And now, we do know that there are machines called CPAP machines. And anyway, those are machines which they put normal air from the room, they pressure it in the mouth, you put a big mask on it like a alien, and they work very, very, very well. They're very expensive, but they work very well. Except this, and have you noticed that with your patients? Almost all people don't seem to be wanting to wear it because they can't sleep. They need to sleep stiff. They can not turn. I mean, they can turn a little bit, but very badly. They have a big hose around it. And it just, they say, I now sleep less than when I'd rather have sleep apnea than having that machine. That's what most people say. So while it is good if you wear it, apparently people don't wear it. And in that case, it's no good at all because people don't wear it. Have you noticed that with your patients also?
Oh, yes. So these days the appliance is not that big. So with this appliance, you can go to good sleep. So I think it's a good idea to go to your dentist and have the appliance.
Beautiful. Thank you very much, Dr. Kahng.